At Piedmont Transplant Institute, we are dedicated to giving patients with kidney failure a second chance. We're extremely proud to have transplanted over 5,000 patients with nearly 1,300 living donor transplants. Our team of highly trained, dedicated specialists have decades of experience caring for transplant recipients and donors. This presentation is an overview of your kidney donor options, how to increase your access to these options, and how to achieve optimum results. A kidney transplant is not a cure for renal failure, but it is potentially a life-saving treatment in eligible patients. It is not always the safest option for everyone, but we can help determine if it's the right choice for you. First, you must complete a comprehensive evaluation process, and your active involvement is very important. We ask that you complete your evaluation checklist as soon as possible. There are two types of kidney transplants. They can come from a deceased donor, which entails a wait list, or they can come from a living donor, which is a healthy person who is willing to donate one of their kidneys. There are more people who need a kidney than donors available, and waiting for a deceased donor kidney can take years. On the right-hand side, you can see how any kidney transplant can have positive outcomes by adding more years to your life, compared to being on dialysis, as shown by the red bar. This survival advantage is even better with a kidney from a living donor, shown by the green bars. Kidneys from a live donor, on average, last longer than a deceased donor kidney. We want to empower you to learn as much as you can about live donation and ways to find a living donor during your evaluation process with us. While transplanted kidneys don't last a lifetime, they will extend the life of anyone healthy enough to get transplanted. Any healthy person can donate a kidney to anyone in need. This could be a relative, a friend, or even a complete stranger. A living donor kidney is the best quality kidney. It functions longer than a kidney from a deceased donor. Plus, you don't have to wait as long. Living kidney donors are heroes. They want to help you. To find a donor requires time and commitment on your part to share your unique story. Online programs like microsite through the National Kidney Registry, seen here as an example, are good online platforms to share your story with potential donors. Social media is a great tool to help distribute your microsite to as many people as possible. The more people that hear your story, the higher your chances are to find a living donor. If someone wants to help but can't donate, they could be your champion, helping you share your story online and in your local community, helping you find a potential kidney donor, and helping you navigate the transplant process. Anyone interested in living donation should contact us to receive information on this process. If interested, an initial health screen with labs can be completed close to home. Keep in mind, we perform a very detailed health evaluation on every interested potential living donor to ensure their safety. Rest assured, live donation is safe and has excellent proven outcomes for both the recipient and the donor. It is our goal to make a positive difference in your life by safeguarding your health and well-being. Paired Kidney Exchange is a very successful national program that strives to match as many patients as possible with live donors. If the donor you find is not compatible with you, we can put you and your donor in a paired kidney exchange program to find a good kidney match. If you find a donor, we will find you a kidney. Even if you and your donor are compatible, there are options through the Paired Kidney Exchange program to find an even better kidney match based on your unique circumstances. For example, we might improve age, size, or immunological match through the Kidney for Life initiatives. Candidates with living donors are part of the Kidney for Life initiative through the National Kidney Exchange program. This program focuses on better immunological matches, which can result in better outcomes for recipients due to fewer graft failures, and a lower risk of kidney rejection. Visit kidneyforlife.org for more information. Deceased donor kidneys are mainly allocated to patients based on their waiting time. Your waiting time will start going back to your dialysis start date, or if you're not on dialysis, the date you are added to the kidney wait list. The longer your wait time, the more competitive you will be to receive a deceased donor kidney. There may be options available to receive a deceased donor transplant sooner, and you have the right to decline any offer. Options for a deceased donor transplant may include: you may be considered for a KDPI kidney greater than 85%, which often comes from an older donor. It can provide you with an opportunity to get transplanted faster, which is associated with better survival and quality of life for you. You can find more information in the transplant process consent document you have received. And your care team will discuss these options with you if you are the right fit for this type of kidney. For eligible diabetic patients on insulin, we may consider a combined kidney and pancreas transplant. Receiving a pancreas transplant will cure your diabetes, but it is associated with more surgical risk. So we are very selective about who will be considered for this type of dual organ transplant. Receiving a kidney pancreas may or may not be faster than receiving a kidney alone. This type of transplant is not for everyone, so your transplant team will discuss this option with you if it applies. A kidney from a donor who had hepatitis B or hepatitis C virus may increase your chances of getting a transplant faster. Hepatitis C is curable, and the medical team will treat you after your kidney transplant. You will be informed if the kidney you are offered has this exposure. Kidneys from donors from prior exposures or active infection with hepatitis B or C have similar outcomes to non-infected kidneys. These type of transplants are very common and outcomes are great with an appropriate treatment. A PHS risk donor means that the donor's lifestyle and behavior may have put them at risk for contracting hepatitis C, hepatitis B, and/or HIV. You will be informed of this risk if this type of kidney becomes available. We always recommend accepting this kidney rather than continuing to wait. All donors are tested to rule out infections, so the risk is extremely low but not zero. Getting your hepatitis B vaccine can protect you. Thankfully, we have excellent treatment options for these viruses after transplant. These infections, if present, are easier to treat than kidney failure. Outcomes with PHS risk donor kidneys are equivalent to non-risk labeled donors. Approximately 25% of kidney transplants performed at Piedmont are from PHS risk donors. Deceased donor kidneys may come from people of any age, some of whom may have medical problems such as high blood pressure, diabetes, stroke, or vascular disease. Some kidneys may take more time to work, meaning you may need to continue dialysis for a few days or weeks. Some of these issues are captured in the Kidney Donor Profile Index, or KDPI score. Lower scores may indicate that the kidney will last longer compared to a kidney with a higher score. Waiting for a lower score kidney may take longer, but waiting longer without a transplant can also have a negative impact on your life. Dialysis is associated with an approximately 10% risk of death per year. Our goal is to get you the right kidney that matches your unique health needs. We will attempt to match you with the best available kidney that allows for the best outcome for you. In some cases, waiting is more dangerous, and we want to take the next best kidney without being too selective. In other cases, we may have time to wait for a kidney that may last longer. In this case, we may pass up on kidney offers until we find the best kidney for you. Our goal is to align your outcome expectations with the type of kidney we may accept for you. For example, If your goal is to get a life-saving transplant and get off the dialysis as fast as possible, we will consider donors who are older with a higher KDPI score. Conversely, we would be more selective for patients who can safely wait a longer time for a kidney that is predicted to last longer. You will be informed of these type of donors that we plan to consider for you and can ask to adjust our approach to kidney offer acceptance for you, so our goals remain aligned. Of course, how long each kidney lasts will depend much more on factors after you are transplanted. It's important to know that transplanted kidneys usually don't last a lifetime. Living donor kidneys, on average, last 15 to 20 years, while deceased donor kidneys may last 8 to 12 years. After transplant, episodes from rejection by your immune system, infection complications, diabetes, vascular disease, and other chronic conditions can play a role in how long a transplanted kidney will last. Transplant is associated with risk. Early surgical complications, including slow wound healing, infections, and delay in transplant function, can occur and are managed by your transplant team. The risk of heart attack, stroke, or death may increase early after surgery, but decreases over time. Medications to prevent rejection work by suppressing your immune system. This can lead to increased infections and increased cancer risk. You will likely need another kidney transplant in the future. Think about optimizing your health 10 years after your first transplant to be ready. Staying healthy, taking your medicines to prevent rejection, managing infections, cancer risk, your blood pressure, and diabetes are all part of keeping your new kidney and you living longer. Your journey before and after your kidney transplant is a partnership. Together, we will strive to ensure the best possible outcome for you, empowering you to live your best life. Our care team is committed to being there for you every step of the way. We will guide you through the evaluation process, give you resources to find a living donor, help you maintain your health on the wait list, manage any post-transplant complications, support you through your recovery after transplant, and plan for retransplant if needed. Please reach out to your coordinator with any questions or concerns.